Welcome to Behavioral Health Champions, in which we engage in conversation with members of the legislature and other stakeholders about how California can really become a national model in trying to create parity when it comes to behavioral health care delivery of services. I'm Kevin Riggs on behalf of the Behavioral Health Action Coalition, which is really set up to try and carry this conversation forward, to try and reduce stigma, and again, to try and improve the delivery of healthcare services for those who are facing behavioral health challenges. And with that, we are joined today by Assemblymember David Chiu, who represents the 17th Assembly District. Thank you for your time.
Thanks for having me on.
Good to see you. Let me start by asking you a little bit about your background. You grew up in Boston. Your parents were immigrants. Give me a sense for how your family's experience shaped you, and then what led you eventually to the study of law and public policy.
Sure. So as you mentioned, I'm the son of Chinese immigrant parents, first kid in my family born in the United States. I was never supposed to grow up to become an elected official or a politician. I come from a healthcare family. My grandfather sold herbs in the old country. My dad was a Western trained physician. I have a lot of nurses, dentists, doctors, my brother's an acupuncturist in my family. They all come out of the healthcare world.
So you grew up with both Eastern and Western medicine.
I did. Yeah.
Interesting.
And the hope for me is the hope for a lot of Chinese immigrant kids. It was that I was going to go to medical school. So I went to college, took my pre-med courses, but it wasn't entirely satisfying, in addition to the fact that my grades weren't great. And ended up, between college and graduate school, working for the mayor's office on health policy in New York City, Mayor David Dinkins, at a time when the healthcare system in New York City was very, very challenged, and was just fascinated by the intersection of how you do good healthcare policy, how you think about it in a way that's fair, addressing the needs of very diverse communities, and that, along with a number of other things, just got me hooked into policy and politics. It wasn't until years later I thought about running for office, but that was the start.
But healthcare has always kind of fueled your interest when it comes to public policy.
I've always been super interested in everything from the micro of like what makes the body tick to why is it that we have prevalent diseases in our communities, why is it that some people have access to healthcare and others don't.
Also, by way of background, before joining the Assembly, you served as president of the San Francisco Board of Supervisors for 6 years. You were the first president in the city's history elected by your colleagues to 3 consecutive terms, and the first Asian American to hold that post. All right. So what inspired you to get involved in civic activities then over the years, and especially since you've come to Sacramento, what are some of the core issues that have particularly interested you?
You know, I think like most of us who are in elected office, we like to try to fix things that are broken in society. At the local level, walking down the street, if it's a broken street light, if the bus isn't running on time, there's a pothole, there is a homeless person on the street or a drug dealer. We're trying to address different issues in the ways that we possibly can. I have always championed issues around housing, given the challenges facing San Francisco that I represent, in California, healthcare. I'm a former civil rights attorney, so that's always been a passion of mine. When it comes to healthcare, worked on a myriad of issues, both locally and at the state level. Everything from how do you reduce the astronomical price of pharmaceutical drugs to how do we achieve universal healthcare. I was one of the co-authors of a single-payer proposal a number of years ago. In recent years, I've been championing how to provide healthcare to all, regardless of your immigration background. Recently, we've had an issue in California of people who are insured who go to hospitals and end up getting enormous, exorbitant surprise bills. So I've been leading the effort to try to address surprise balance billing, but just a myriad of issues that are important to me and also hopefully have some impact on the world.
And as you look back to your time at City Hall and then your more recent history at the state capitol, what has been, I guess, more fulfilling to you to work on healthcare issues from a macro perspective as opposed to a more local perspective?
Yeah.
What has been the most fulfilling for you, I guess?
You know, it's working at the local and the state level are fulfilling in different ways. At the local level, you can really try to tangibly impact the lives of this person and that person who I know and see, who are my constituents in my neighborhoods. Whereas at the state level, we are required to propose solutions for 40 million Californians, the 5th largest economy in the world. It's a different set of ways of how we think about helping people. It's a bit more, it's broader.
Sort of abstract in a way.
It's a bit more abstract, but the opportunity to impact more people is there. I often refer to some of the differences between local and state government as the old story about the person who's at a riverbank and sees babies floating by. And at the local level, your job is to run into the river and try to save as many babies as you can who are floating down the river who are in trouble. And I often think at the state level we're trying to get at root causes, trying to rather than running into the river and saving one baby at a time, asking the question, why are babies floating down the river? What can we do systemically to go upstream and stop what's causing the problems that we're seeing in our local communities?
Behavioral Health Action, this coalition that I talked about at the beginning of the interview. It's a coalition of more than 50 statewide organizations, stakeholders, some individuals, and they are committed to elevating, educating, innovating as we look at the behavioral health space. I think one of the fundamental issues that they talk about is that we treat diseases of the mind and diseases of the body in different ways. And so in some ways you have separate healthcare delivery systems for those two. What's wrong with that approach, and what do we need to do to change that, do you think?
Well, there's certainly always been a stigma around thinking around behavioral health issues, mental health issues, other related issues. It hasn't gotten the attention that it deserves. And this is true when it comes to funding. This is true in how these areas of healthcare are addressed in the law. There isn't the kind of equity that we want. And there really is a tremendous stigma. As I was thinking about this interview, I thought back to my own experience of one of my closest friends from graduate school, who in part was responsible for why I decided to go to graduate school in public policy, and she actually convinced me to then apply to law school. She was one of the most amazing, intelligent, dynamic individuals you could have ever met. And I say that with great sincerity, having met thousands and thousands of people over the course of my career. She committed suicide in the middle of my time in graduate school. None of us had any idea that she was suffering. There wasn't the space, probably the acceptance for people to talk about these issues. Years later, I can only imagine what might have been going through her mind, the potential healthcare issues that she was struggling with that she never felt comfortable discussing with anyone.
And no one had an inkling.
And no one had any inkling. We were just all blown away by what happened. And that experience when I was a 21-year-old really kind of shaped how I thought about behavioral health issues and just how important it is for us to acknowledge these issues, to make sure they get treated, to make sure that our friends and families are addressing these issues, but also ensure that the broader healthcare system is dealing with these in the ways that the crisis deserves.
Is stigma also an issue in terms of culturally? There are some groups that are even more unwilling to talk about it than others, do you believe?
Absolutely. In fact, my friend she was South Asian, and within Asian immigrant communities, it's often taboo to talk about mental health issues. It's just not something that you discuss. There's not even a lot of language to describe it. I currently chair the Asian Pacific Islander Legislative Caucus in the state of California, and we did a series of listening tours this past year, going to communities up and down the state. And one of the very top issues that completely surprised us that came out through all the discussions, and I'm talking about meetings, town halls we had in San Diego, Stockton, Orange County, LA, San Jose, Oakland, San Francisco, was issues of behavioral health, mental health, from a lot of fronts, from recent immigrant communities who are refugees dealing with post-traumatic stress to suburban kids dealing with the pressure cooker in suburban high school communities, to everything in between. And within a lot of Asian communities and immigrant communities, people don't talk about behavioral health issues. People don't talk about mental health issues, substance abuse, etc. And we've got to surface these issues. We have to be willing to address the stigma, to let the public know, let our family members know that if you are confronting a behavioral health issue, it's like dealing with a physical health issue. You have a cold, you may be suffering from depression. We've got to talk about this, think about it, address it in a different way.
A lot of school kids suffer from depression and other examples of behavioral health challenges, whether it's performance in terms of academics or athletics or whatever, but an amazing number of kids today are being treated for depression and things like that. That's another example of what you're talking about.
Absolutely, and my guess is in non-immigrant communities, over time it's become a little easier to talk about it, and parents and kids can have an open conversation about it. If you need medication, it's a bit more accepted. Whereas in immigrant communities, these things are just not discussed. You are told you're not tough enough, you're not strong enough, just suck it up, and the pressure just continues. And oftentimes, a lot of parents, a lot of students don't know there's help out there, counselors, health professionals, medication that could assist your situation.
So what you're saying, it sounds like, is that California, at least historically, has kind of been on the wrong track when it comes to dealing with this issue. Strategically, what can we do better?
I think the whole country has, frankly, been on the wrong track. I used to work in the U.S. Senate, and there was, while I'm a progressive Democrat, I remember a Republican Senator, Pete Domenici, who was a national leader talking about how behavioral health issues impacted his family. And nationally, our healthcare system, our public, these are not easy topics to discuss. People often sort of shunt them aside. But really in the last couple of years, I think the conversation is happening around parity, around imbalancing the inequities between the behavioral health system and other parts of our healthcare system, about educating the public on what we're talking about. But yeah, I would say that in California, like many other states, we've been behind. We haven't been dealing with these issues, and I think they're evidenced by what we see as far as behavioral health issues in our criminal justice system, when it comes to homelessness, when it comes to students who drop out of school, who aren't successful in the workforce. All of these issues are probably stem from the fact that as a society, we've not done a great job of addressing behavioral health. Now, that being said, I would say in the last couple of years, there has been a lot of good forward movement. Many of us who are policymakers are talking about these issues. I think from a governmental standpoint, if you look at our budget, we're starting to spend more money when it comes to behavioral health. We're starting to call these issues as they are. And we're starting to see that what we had experienced as sort of challenges within, say, the healthcare system, the education system, the criminal justice system, our housing system, our homeless social safety network, many of these issues intersect very closely with behavioral health issues. And if we can address the behavioral health challenges, we can make headway in each of these areas and address the silos.
And along those lines, as of January, we have a new governor who has expressed a lot of interest in behavioral health. And what opportunity does that establish, do you think, to sort of change the conversation that you mentioned a moment ago?
Oh, it's a game changer. I mean, there are a number of us in the legislature who have prioritized these issues, who know we need to do more. But to have the head of the executive branch working with legislators to move these issues forward, that changes the politics of how we get things done.
If the goal is to lead the nation, serve as some sort of a national role model in terms of coming up with a more comprehensive and more connected healthcare system, how important is it for California to prioritize investments in the prevention side of things, not just the treatment side, but the actual diagnosis and prevention side?
California, we pride ourselves on leading the nation when it comes to difficult policy discussions. In fact, if you could look at a lot of areas, from civil rights to the environment to healthcare and beyond, when California moves, when we lead, we're often a bellwether for where the nation's challenges are going, but where potential solutions are going. So I think it's important for us to lead on this issue. When it comes to prevention, the old adage, the ounce of prevention is worth a pound of cure. And we spend so much money on the back end trying to address behavioral issues. So for example, let's take the criminal justice system. When you have substance abuse and you don't address it with treatment in our jails and prisons, and people finish their terms, they're far more likely to reoffend, with all the cost to society of someone who commits another crime back into a very expensive criminal justice system than if we treat them in the criminal justice system. So this is why this year I proposed for the first time a very significant expansion of medication-assisted treatment in our county jails. We know that the combination of cutting-edge medication plus counseling can help people who are inmates in our jail system to, when they come out, not end up re-abusing. And we know that the data is clear. Every dollar we spend on these programs will save many dollars outside the system. We're starting to have this debate. Governor Newsom had actually led on putting more of these dollars in our state prisons with our most serious felons, but I think we need to do it for misdemeanor offenses and others who are sitting in our jail system, which is the less serious offender population, to make sure that when they come out, they are not becoming re-addicted to drugs and become serial substance abusers. It's far smarter for us to do it this way, and that's the kind of conversation we need around prevention.
Was it a budget trailer bill, or was it a separate piece of legislation?
It was actually both a piece of legislation and a budget request, and it's an ongoing discussion we're going to have around substance abuse and medication-assisted treatment, otherwise known as MET. But it's one of many examples of what we need to do.
But it was not included in this last budget go-round?
There was money in this last go-round for more money into our state prisons, which are for generally our felon
but not
population.
the local level.
But not for the local level. And the local level, when you have, say, 60% of current inmates who have a substance abuse challenge, and if you're not treating their substance abuse, if you force them to go cold turkey in a jail or prison facility and they come out, they're much more likely to reoffend than if you give them things to help them deal with getting off of their substance abuse issues. And that's what we're trying to do.
The homelessness issue, it seems to be expanding, and you see it in all kinds of cities, mid-sized, small, large. I think about the statistics are that about 1/4 of California's homeless are considered to be chronically homeless. While those who are homeless and have a behavioral health condition do have access to health care, social services, a lot of people will tell us that current programs and funding streams are not really integrated. So how should we change that situation right now so it is more of a streamlined, integrated?
You know, many of the systems that we're talking about, our healthcare system, our education system, our job, workforce, economy, housing, they're not integrated. And a lot of these problems are interlinked. A couple years ago, I moved forward a discussion about the links between homelessness, housing, and healthcare. And here's the problem we were trying to address. For the vast majority of chronically homeless individuals who are on our Medi-Cal system, when they're on the streets and they don't have a roof over their heads, they cost the world $80,000 to $85,000 a year because of the fact that they are cycling in and out of our emergency rooms, out of our mental health wards, out of our jailhouse system. They're being picked up by very expensive fire truck pickups, and it's super expensive. And they're really suffering from a lot of health issues, both physical issues, but also behavioral issues, whether they have a substance abuse challenge or a mental health issue. It is far cheaper and far more humane to put a roof over their head into a supportive housing situation. So everyone knows the most effective way to address someone who's homeless is to provide them with supportive housing. So
not just housing.
Not just housing, but housing with the services that they need. And for someone who I just described, the mental health services, the substance abuse treatment, a counselor, someone who can help them get them back on their feet, that typically costs society $20,000 to $25,000. And so I propose the following. Why don't we run a pilot program and compare what, say, $60 million of Medi-Cal funding that would otherwise go to a chronically homeless person on the street. Let's take that money, put a supportive housing roof over their heads with the services I just mentioned, and see what it does. And what we know is going to happen is we can address far more needs, and we can address the behavioral root causes of what's going on, and do it more humanely and do it more effectively and more efficiently from a budget standpoint than if we keep doing what we're doing now. The definition of insanity is you keep doing what you're doing, the status quo. And so our Housing for a Healthy California program was signed into law by Governor Brown, funded this year by Governor Newsom. We will see in the next couple of years, I have no doubt that it will bear out what we describe, which is if you spend an ounce on prevention, you address both homelessness and behavioral health issues and other healthcare issues, this is the way we need to do things, and breaking down the silos, thinking holistically across systems, thinking about a person from what we refer to as kind of a whole person model, right? A person is not just part behavioral health, part a workforce, part future students. All of these things are intermingled together, and we need to break down those silos and address them holistically.
So will that pilot program be centered just here in San Francisco?
The pilot program is going to be taking place in a number of jurisdictions in California, okay. And we'll see in a couple years what the data is, but I am confident the data will show that it is far more humane and much more cost-effective to deal with these issues holistically, deal with the behavioral health issues, deal with the homeless issues, than it is to separate them.
As we've been talking about, there's lots of opportunities here for innovation and investment and to try and improve the system. And as I mentioned earlier, this Behavioral Health Action Coalition really is interested in working with lawmakers like you to try and create parity and to try and improve delivery of healthcare services. What would you say the coalition can do in terms of working with you? They're really interested in doing that. Looking forward, how can they work with you on this issue?
Well, as I've told my staff in the last couple months, we're going to be, at the end of this legislative session, starting to think about ideas for next legislative session. Always looking for the best and brightest ideas out there, particularly looking in the area of behavioral health, mental health, substance abuse, etc., of what we can do to address the challenges we face. So happy to receive ideas. I should also say the coalition has done a great job of raising the awareness on these issues and encouraging and pushing those of us who are policymakers to be more front and center to talk about these issues. I realize I didn't mention that another just personal connection I have to this was years ago when I was in my early 20s. I had someone in my extended family, a relative of mine, who was incredibly bright, really kind of a star in our family, and then he ended up having a bit of a mental health breakdown. And in part because we were able to get early intervention, we were able to get him the help that he needed so that he didn't become, he didn't harm himself and didn't harm others, and we were able to help stabilize his situation. And every Californian has people in their lives who are suffering from behavioral health issues, and getting us as a society to acknowledge that, eliminating the stigma, and thinking what are the smartest ways in which we can use the resources of our state to address this. That's what we need to do. We need to come together on this.
As you say, it's a story much more common than many people think.
Mm-hmm. Absolutely.
Yeah. All right, Assemblymember David Chiu, thank you for your time.
Thank you.
We appreciate it.
Thanks for your work.
And thanks for joining us. Behavioral Health Champions is a production of the Behavioral Health Action Coalition, which again is 50 or more statewide organizations that have come together to try and reduce stigma and to try and improve delivery of healthcare services across the state. Thanks for joining us.